I am Dr.APS Suri, working as a diabetic foot care specialist, podiatric surgeon, working in New Delhi. I am president of Indian Podiatry Association, in which we do lot of awareness camps, CMEs, diabetic foot care workshops. 4 times in a year we do, and we have an online course to educate doctors. Mainly, the main goal of Indian Podiatry Association is that we need to educate doctors in new technology of wound care so that we can save these people, our patients who are suffering with amputations. To save the lower limb amputation, we have got one good technology which is known as ozone therapy. Now, how ozone works is, this is one of the ozone unit we are using at our center, and it has got two outlets, port 1 and port 2, where we can do two patients together. The oxygen cylinder, the oxygen from the oxygen cylinders comes into this unit, and outlet we converts, oxygen is O2. So this unit converts O2 to O3. The O3 is ozone, and ozone is considered to be one of the most effective antiseptic gases or antiseptic solution for the wounds which are really infected, and it has a antimicrobial effect and anti-infective effects. And we put we have to open the dressing of the patient, and whole leg of the patient goes inside the bag. So there's an ozone bag, and the outlet, the tube from here goes into the ozone bag, and this therapy is given for about 45 minutes, and patient is very comfortable. He's sitting, the ozone goes into the bag, and that ozone locally it kills whatever anti-infective IV antibiotics or whatever antibiotics we are giving systematically, that's okay, but this works topically. And this is one of the very good results we have seen with Staph aureus infection, Pseudomonas infection, Klebsiella infection, E. coli infection which are there. And also it kills the biofilm which is impregnated in the chronic wounds. We do that. We can do that on the pressure ulcers on the buttocks, pressure ulcers on the hands, pressure ulcers on the heel, on the posterior part of the heel. That can also be taken up with ozone therapy. So this is a very good unit. You can have it in your clinic. And ozone, try to use ozone as much as possible for your very severe exudating infective ulcers, and it has got a good results. You have to do it daily for about 7 days, 8 days, 10 days, and then you see slowly the granulation tissue develops. There are only two precautions you have to take with ozone therapy. One, you should not do that in a closed room. And also you should give a mask to the patient and to your staff who is doing it, because ozone is toxic for the alveoli of the lungs. So it is not good. So patient should not inhale, and wherever the patient is sitting, you should have a window or an exhaust pipe or an exhaust fan should be there, or you can do that in an open space outside the clinic, or where you have got a small place where the window is there, and with an exhaust fan, there you should do that, not to do in a closed room. So these are only two contraindication, or I'll say precautions you have to take with ozone. Otherwise, this is one of the very safe therapies.
What are the indications? Just infection, or is there any other indication?
Infective ulcers, all type of infective ulcers can be taken up.
And this is
something around 5 to 10 sittings are required. Do not go more than that. Also, people are injecting into the blood ozone. But that is under very limited condition. It is done in the ICU or in the hospital setting. It can be done. Orthopedic surgeons, they are injecting ozone in the disc, in the spinal cord for discectomy, like ozone discectomy. And even people are injecting ozone for the chronic.
are there any clinical trials for those kind of interventions?
No, not yet. I don't think so. But for infective ulcers, for diabetic foot ulcers, there are evidence that ozone works into this.
Okay. So basically, you do this, and you have to use this as a multi-modality approach.
Yes.
That includes regular.
When you are doing dressings, you can.
The debridement, like the basic wound care.
After the debridement, with the dressing, you can add ozone therapy.
So that is, in addition, this is like an adjuvant therapy to the standard wound care that involves debridement, exudate management, infection control, nutrition, and offloading. And if you add to this, then we should be able to do some clinical studies doing this, and standardized solution.
The very important thing is that we should add this. We have got an app for the wound care. So this should be included in the app. And with this app is very important, because whenever you take the picture of the wound, any wound, you put that in the app. So any one of us, or Dr. Ravi Kamepalli has recently launched this app, the wound care app in the country. This is very beneficial for all doctors dealing in wound care or diabetic foot care or podiatry. And this helps you to make the healthy wounds into this. So ozone should be added up with the app. So ozone, people who are dealing with ozone therapy, they should approach Dr. Ravi Kamepalli. They should adjust yourself with the application. It's an online app where all doctors should have that app into their practice, into the mobile phones. Immediately they can click the picture, put in the data, and then immediately you get the how much is the exudate, how much reduction in the wound care. That is one of the unique app which is not available in our country. So this app of wound care is very good, and we should add ozone into with the app also.
So any other thing you want to say about the whole process of wound care delivery process in India, and what advances are you planning?
In India, wound care is now picking up. Lots and lots diabetic foot surgeons are coming up. Even general surgeons, they are practicing diabetic foot care. Plastic surgeons, orthopedic surgeons, diabetologists. In this, we under Indian Podiatry Association are doing camps, doing workshops, doing online course. We educate doctors dealing in new technology. New technology could be PRP, platelet-rich plasma. This is one thing which we are doing, and the wound heals very well. Ozone therapy is one other thing. Hyperbaric oxygen therapy we do a lot for diffuse peripheral vascular disease patients. And also we do lot of offloading technique, lot of new type of AFOs and orthosis and soles. These are available. So we should do these offloading techniques are there. And new dressings like foam dressings, honey dressings, calcium alginate dressing, hydrogels. Lot of new things are available. Anything which is available internationally is now available in our country.
And Indian Podiatry Association is working hard to make things easier on the providers with education and offerings of different solutions, and trying to set up centers across the country.
Yes, Indian Podiatry Association is now getting very active. We have got 8 chapters of Indian Podiatry Association. We have a chapter running in Karnataka, in Tamil Nadu, in Haryana, in Bihar. Recently we launched in Telangana. Yesterday we did a chapter in Rajasthan. Next week we are doing in Gujarat. So more and more people dealing in diabetic foot care are joining us. We are helping them to use this technology in their practices, how to early identify people with neuropathy, early identify people with peripheral vascular disease, how to offload the wounds, new technology like ozone, PRP, VAC therapy, ultrasonic debridement, hyperbaric oxygen therapy, offloading techniques.
So,
we are teaching to doctors and opening clinic. But very important with all this technology is to take an app. Wound care app is very important if you are working in any type of chronic wounds, or if you are dealing in chronic wounds or in diabetic wounds, because with the app your area of specialization or field of working is very proper. It's evidence based and document. You collect the data. Data collection is very important. Every every doctor should collect data in the clinic, like 100 patients, 200 patients for neuropathic ulcers, 100 200 patients for ischemic ulcers, for exudating ulcers, for pressure ulcers, chronic wounds. This collection of data can be done with app, and then you can publish that data.
And a community of support for the doctors?
For support of the doctors, community support is there. We from Indian Podiatry Association are always there for the core. We have got a core group consisting of myself, Dr. Ravi Kamepalli, Dr. Rajni Saxena, Dr. Sanjay Kale, and many other people are there who immediately are over there to help you with this community help.
So thank you very much, and hopefully we'll be doing more of a series of different interviews on this aspect, and make sure that we democratize and also sustain wound healing and support the wound healing process in this country and hopefully across the world.
Yes.
Thank you very much.
Thank you. Thank you.